Good afternoon. I am Valerie R. Austin and the author of the Student's Comprehensive Guide for College and Other Life Lessons. I wrote the book to assist high school students and their parents to navigate the journey of careers in college. I am also the host of the Employer Speaks series, which is designed to highlight different careers and the paths to achieving those careers. Today, I have a very special guest. Dr. Robert Campbell Jr. is an epidemiologist and the former assistant professor of epidemiology at Eastern Virginia Medical School of Health Professions, Master in Public Health program. Dr. Campbell has extensive experiences in health services and outcomes research in academic, federal government, military, and regulatory settings. His research incorporates health disparities and includes systematic lupus, diabetes, lung cancer, and other diseases. He's a graduate of the Citadel, the Military College of South Carolina, with a bachelor's degree in modern languages, The Ohio State with a Master's of Science in Preventive Medicine, and Case Western Reserve University, where he earned a PhD in epidemiology and biostatistics. Dr. Campbell is also a retired U.S. Air Force Reserve Lieutenant Colonel with 26 years of military service. He is a 10-year-plus member of Stop Abuse, a childhood sexual abuse prevention organization, and a lifetime member of Kappa Alpha Psi Fraternity Incorporated. I look forward to this discussion with Robert, where we explore the exciting career of epidemiology. Thank you for watching. Good afternoon. I am Valerie R. Austin and the host of the Employer Speaks series. Today I have a very special guest. Dr. Robert Campbell Jr. is a clinical research epidemiologist and a retired lieutenant colonel with the Air Force Reserve. Robert and I are going to discuss the fascinating career of epidemiology. Thank you so much, Robert, for being on Employer Speaks.
Emily, thank you for giving me the opportunity to do so.
Fantastic. Well, let's get started. Explain what is the science of epidemiology and briefly what an epidemiologist does.
Okay. I consider epidemiology to be the study of diseases. In particular, what are the factors or the causes are contributing or associated with the disease itself. So I like to consider myself as, believe it or not, as a detective of diseases and trying to figure out what those factors are causing the disease. So not only to identify, but to prevent or eliminate, negative outcomes, which more or less would include probably mortality, such as death, or more or less bad or, poor quality of life.
Okay, no problem. I love it that you're brief and getting to the point of because it could be so much to epidemiology. So thank you for that. So what is your current job title, employer, and day-to-day responsibilities as a clinical research epidemiologist?
Currently, I'm actually a consultant, no longer teaching. After 5 years, we're kind of taking a break and we're making a transition. However, I still have partnerships or collaborations with our colleagues who are still at the institution where I actually have been teaching for 5 years. So we're conducting a myriad of diseases, outcomes, which we're looking at in particular, chronic diseases, infectious diseases. But my concentration is primarily what we call health disparities. Those diseases which disproportionately, I should say, affect us, meaning African Americans. That's my concentration. And it's primarily as a result of our, personal diseases which affect the family, which we'll probably, discuss more in detail later.
Okay, no problem. Well, thank you so much for that. Now, what is the role of an epidemiologist in public health? And for those who don't know, public health revolves around preventing disease, prolonging life, and promoting health in the population.
Right. Well, you can consider, like I said, the epidemiologist consider the detective, but the detective needs to use certain skills. Needs to have certain backgrounds or education, in particular, special softwares or access to our data or so, and analyzing the data. So when you're presenting the data, it makes sense to what we call a lay individual, and you're more or less discussing, hey, as a result of these results or so, this is what you need to do or not to do in order to either prevent the disease or to more or less increase or improve the quality of life for a specific group of people
Okay. All right. Well, that sounds fantastic. Now, did you have educators like teachers or mentors or academic programs in high school or college that directed you to the types of occupations that are in public health? How did you think about being an epidemiologist?
No, that's a good point. No, I would say I guess my my counselors, I would say not necessarily to public health or epidemiology because it was relatively new. I won't necessarily talk about what year that was. We're not going to talk about age here, but at that time, I did pretty well on standardized test scores, tests, I should say, and my scores are pretty decent or pretty high, above average. So, in that case, everyone's suggesting, teachers and guidance counselors suggesting, oh, you should become what, a doctor. And I said, I don't want to be a doctor, because of probably stories from my mom. My mom was a nurse, and she would talk about how mean the doctors were. So, and I said, okay, but I believe in being proactive. You think of epidemiologists being proactive versus reactionary, like doctors are. Sorry, they're more or less helping individuals who suffer from a condition. So let's prevent that condition so we won't necessarily need to go to the doctor. So
Okay.
I tell my students.
Well, if I may interrupt it, if you didn't have any mentors or educators who pushed you toward public health, they said a doctor. Well, when did epidemiology become something that you wanted to pursue then? Was that in college?
I guess it was after college, more or less, because in college I majored in French,
French.
so
Yeah.
it wasn't necessarily. But actually, it's the personal statement I alluded to earlier, in terms of my aunt developed the disease, which we had no idea it was, and it took doctors almost 15 years. She was in upstate Massachusetts to actually figure out what was going on with her. When she moved back to help take care of my grandma, they found out that, hey, it was this disease called lupus, in particular systemic lupus erythematosus.
Mhm.
And about 5 years later, we found out that my sister also had this disease, although she had a mild version. So
Mm.
I just remember all the different tests my aunt went through, and I guess just the poor quality of life in terms of the symptoms or so. And I said, hey, at that time, of course, and it's still to the day, there's no cure for lupus. So it was discussed that, hey, I said, hey, if I'm going to study something, I want to make sure it's personal and it's going to benefit my people and particularly my family members.
So from personal experience, it was after college. How many years after college did you decide that you were going to epidemiology then?
Well, discussing what year I graduated.
No. I mean, just.
Okay. No, I would say actually it was started off in my master's program because
All
keep
right.
in mind, I after college I went into the Air Force, so I always had kind of two degrees, not two degrees, but two careers. So I more or less pursued my military I guess pursuits or desires after college as as a flight officer, in particular as a navigator. And once I was placed on reserve duty after flight school didn't work out, I said, hey, I can really go after my love in terms of research and pseudo medicine. So it was my master's program. So it probably was like probably 5-10 years after college, actually.
All right. So with that being said, as you alluded to college, you had earned a bachelor's degree in modern languages, French from the Citadel, the Military College of South Carolina. You're a retired U.S. Air Force Reserve Lieutenant Colonel with over 26 years distinguished service. How were you able to link that military career with what you obtained in college and also, just being an Air Force officer, those career goals?
No, that's an excellent question. And the response is, as a reserve officer, since your civilian position is not necessarily related to your military career. So during the summer as a reservist, so that's when it was required that I would do, let's say, deployments or contingencies, go out of the country or so. Classes were already over for the summer for the most part. So it was like the best, it was the best part-time job ever. It was above minimum wages or so, got a chance to travel. And so as a result, I could actually pursue my love, which was the medicine, or the pre-medicine, the preventive medicine aspect of it. And in the meantime, more or less get paid for doing so. But as in any job or so, there are various aspects of a job which you can use in any field, in any area. But and particularly as a reservist in the Air Force, we would be constantly trained for various positions. So I've got over what we call AFCs, Air Force Specialty Codes. I've got over 7 different Air Force Specialty Codes in terms of jobs. at least experiences. In many cases, they train you to do that. So there's so many applications for either of the jobs in which you can use in civilian settings. So.
Oh, okay. So as an Air Force reservist, you did your 1 week in a month, your training during the summer, but then you were able to actually pursue that career as an epidemiologist. Basically, it's what it is.
Simultaneously, correct.
Okay,
right.
okay.
Absolutely. Well, and because of the special type of reservist I actually had more or less, I had to do 2, let's say, weeks per month versus the 1 weekend, sometimes 2 weekends.
Okay, all right. Now you earned your title of Dr. Campbell because you have a Doctor of Philosophy or PhD in Epidemiology and Biostatistics from Case Western Reserve University. It's a School of Medicine in Ohio. How is an epidemiologist who has a PhD different than a medical doctor who has a PhD?
Okay, well, a medical doctor, more or less, is primarily concerned with treating patients, okay, or they're clinicians or so. So they write prescriptions for, medications after seeing the actual patients. If I tried seeing a patient, I would be arrested because I'm not qualified. Okay, so PhD more or less as any PhD in education, just so happens I've got PhD in epidemiology, can be a PhD in any field or so, but I'm not authorized, to actually see patients. I'm more or less a specialty or an expert in research and analysis of data per se. Just so happens my concentration is epidemiology. However, there are doctors, MDs, who are PhDs as well. MD,
so
PhD.
you can be an epidemiologist and a medical doctor, epidemiologist with a PhD and a medical doctor with a PhD.
Absolutely, you can be MD, PhD. There's several. Absolutely, they don't really. Doctors, you don't really call them doctor. It's just like general.
Just doctor.
Right, it's just a doctor, but they have the specialty which allows them to do research. That's what it's about. It's impressive and it's helpful that they're applying for the creme of the creme in terms of grants, which are NIH, National Institutes of Health grants.
Right. So let me ask you this. You have a PhD in epidemiology and biostatistics. When I was looking up information about epidemiology, biostatistics kept coming up. Biostatistics and epidemiology, biostatistics alone. What's biostatistics and how does it link to epidemiology?
Okay. Well, here's where my French or my study of language comes in play. So it's about words or so. So bio, let's take out bio, the body, human. So statistics, analysis of numbers, a collection of data and analyzing the data. So you're using the collection of data more or less which pertains to humans, either body measurements or body function.
Okay, so statistics for the body, basically what it is.
That's all it is.
Okay, cool. Sounds like a plan. Now, you mentioned it yourself in terms of epidemiologists are sometimes called disease detectives, where they collect and interpret data about disease outbreaks, causes, and locations, and then they come up with strategies. Now, I'm going to ask you for your insights about COVID-19 and what happened with that fiasco with the public health response. Did you have any insights about that one? What happened?
Well, you have to remember that we in the United States, more or less, we're a free country or so. So other countries, hey, this is a mandate. This is what you need to do. You need to do it. I think one of the great things of being American and living in the United States is we have the option to do things, either get tested or later get vaccinated or not. So I know you classify it as a fiasco, but I mean it was relatively new for us. So we need to have the proper organizations involved in the CDC and NIH. So it takes time to analyze this particular variant, and as a result, the information which was found out later becomes, I guess, policy in a sense. So we didn't know. There were so many unknowns in a sense until we found out, what this disease was about. That would determine exactly what we needed to do at that time.
So there were a lot of unknowns and the data was actually behind the actual disease to the point that when the word was trying to be communicated to the public, it was sometimes a step behind, basically.
That, as well as the individuals who, in the top levels, without being political, didn't think it was an issue. So that had something to do with, this is just a cold, this is just a virus. And we need to, individuals said, in terms of public health individuals, believe that this needs to be taken more seriously. And our commander in chief, our a president necessarily believed that at that time. So as a result, it created much doubt per se. As a result, a lot of people thought that more or less this was not as serious as it became, of course, much later.
Well, let me ask you this. I looked at a random university's Master's of Public Health epidemiology degree. It was like 45 program of courses that included ethics, policy, data management, and applied data laboratory. A lot of science in there. Do you think exposure to communications, public relations, or social media training might be good additions because of the politicization of public health?
That's a good question too. However, think about the 45 hours, 36 hours, which was required for a master's degree. We've got experts or so who've thought about what courses are required to make this person competent, being able to do the job. And once that person leaves, at least for a master's program, MS or MPH, Masters in Public Health, the last thing more or less they need to be worried about, or they would be, placed in a position to have to speak on behalf of an organization. You have senior individuals who'll be doing that. Their concentration is their job. Okay, so there's a spokesperson for that particular organization. They're more like a high-ranking individual, senior individual. Wow. So they've already received the proper training. So we don't necessarily need to include that because you get any particular outcome or disease can be politicized. So
okay, so for epidemiologists, they're typically going to be the people in the background providing the data and doing the research.
Absolutely. Right, and think about the senior individuals who've been speaking. They're not master's level, MS or MPH, MD, PhD, like Dr. Fauci. He's the director, National Institutes of Health, component in terms of infections and more allergies and infectious diseases. So there's no master's level person. He's got many years in terms of experience in terms of talking.
So with that being said, it's really the stakeholders involved that are going to deal with a public health issue more so than epidemiologists. Well, let me ask you this. So we're going to go on a high note with this one. What do you find enjoyable and fulfilling about being an epidemiologist?
I guess I started off by saying the ability to look at our health disparities and to study diseases, which of course affect my family personally, like I said, lupus or so, being proactive versus reactionary. So I've had the opportunity to actually study disease which affected my family. Lost, an aunt, a sister with lupus, and 2 second cousins or so. So that's personal. So I have the ability, again, to try to make a difference, if not new treatments, but better therapies.
All right. Now, if you're in high school and you're listening to this conversation, looking at you and saying, wow, I want to be like him. What type of classes should high school students take to prepare for their undergraduate and their possibly postgraduate career in epidemiology? We're talking math, statistics, biology. What type of classes would you recommend?
Well, if statistics is offered, that would be perfect. But in many high schools, statistics is not an option. So if not, I think all courses all high schools offer algebra 1, 2, and 3. I think algebra 3 is considered trigonometry. That would help later, but at least algebra 1 and algebra 2 and geometry. And the master's program, the students are given the basics in terms of statistics or so. So it's primarily our fractions, calculations and rates or so. So if you're pretty good with algebra or so, and geometry is not necessarily needed, it'll be helpful for later analysis. And I would say some computer science courses, because it'll prepare you to actually program using various types of program languages which exist as a biostatistician or epidemiologist.
Well, what about biology?
Biology is helpful per se, but again, it's not like, again, you're a clinician or so. You should have a general idea, the understanding. I took biology in high school, but necessarily helped. I took chemistry. I think that was more helpful.
Okay, so chemistry, statistics, algebra 3,
algebra, geometry. Yes.
Okay. Now, you mentioned some types of skills, but let me list a couple. Problem solving, critical thinking, attention to detail, leadership, communications. Would you say those are something that you need as an epidemiology? Would you add something? Would you delete something from that list?
Well, I think those are great characteristics to have, but I think that's needed. They're needed in any particular, profession per se. I guess more so critical analysis are, once we have the data or so, in that sense, I would stress the critical analysis. What do you do with it? what does that mean in terms of new policies itself? And sometimes we're not used to thinking outside the box, but the critical analysis component would be helpful, and being able to relay the results or so public speaking, getting used to speaking in public would be great too.
All right. Yeah. Now, is there a lot of reading and writing as an epidemiologist? Because you're talking about a lot of research. So is that something that a high school student and even a undergraduate college student needs to focus on too?
Yes.
You can't get away with not reading, huh? You can't get away with not writing, huh?
You can. In terms of research, you're basing your research based upon what's previously been done, because in order to be published or so, you've got to add to the existing body of literature. So in order to add, you've got to know what's there. So looking at the references, hopefully your work will be a reference for someone too. But you've got to read the references at the end of the paper and figure out, okay, based upon this, and that'll take you to another reference yourself. So it's constantly a lot of reading, and I'm still doing that now in terms of you don't have time for leisurely reading, even if you've got, you're pretty much disciplined. So, but it requires a lot of reading, but it's interesting topics. So it's based upon your research. And of course, if you're undergoing 3 or 4 or 7 different projects, you're doing a lot of reading.
So it really needs to be a passion. Because I've had people say, I don't like to read. I would be like, well, you don't need to be an epidemiologist, because that's not a good thing. You don't need to read a contract, because that's not a good thing. You don't know how to read. Okay. Or not know how to read, but you don't like to read. All right. So if you're an undergraduate at a college, what majors or program of study are best suited to pursue a career in epidemiology?
That's a good point. Another good question. But as I stated before, most master's in public health programs actually teach a student how to become an epidemiologist. So there aren't any required degrees per se.
I could be a philosophy major and go on and become an epidemiologist.
Absolutely. As a master's MPH student, we're looking at more or less your skills in terms of quantitative skills, because the weeder course would be more or less the biostats. So if you've done well in algebra, or geometry, even trig, or even pre-calculus or calculus, then you shouldn't have any problems. Computer science would be nice. Again, a computer science course, again, as I stated earlier, in order to learn how to program itself. But there are no specific majors. And again, keep in mind, epidemiology is relatively new in terms of the undergraduate level, and definitely within the high school level. So there are no specific programs which are designed to teach a student besides us, of course, and even at an undergraduate level too.
And you said it's relatively new. What do you mean by that in terms of?
In terms of relatively new, and I guess getting the exposure or being known for the importance in which the work in which an epidemiologist actually contributes to research. But so often they've been left out of the game or so until someone says, oh, did we get an epidemiologist to study, to look at the results, to talk about what we call the study design, the stats, and they're correct, whether it's a biostatistician or not. They include that as well as an epidemiologist.
So if you're an undergraduate student and you're like, well, this sounds like something that I'd really be interested in. I'm in basket weaving 101. I'm just kidding, but basket weaving 101 with a high concentration of math and a little bit of chemistry. What's your best sources for getting information and guidance about potential careers in epidemiology? Are we talking professors, current students in the appropriate programs, department academic advisors, internships? Where do you get information? How do you research being an epidemiologist?
You probably get this answer all the time, starting off by Googling it.
Yes, that's what I did.
Right, but that's a start. But you go directly to the source. So if you're exposed to the epidemiologist, you talk to the professor itself, or of the students who are in the program. That's if you're in school already. Let's say for those who are in high school, your guidance counselors or so. It starts off with Googling it, but contact the local or school. See if they've got a school of for health profession or a school of public health to ask to speak to an epidemiologist, and that's a perfect recruiting tool for them. Many of times we've had students who've contacted us and actually asked to do our projects, which we've been able to help, and we're still mentoring them actually. So it's been great. It's an honor for someone to contact. Hey, Dr. Campbell, I saw you doing such and such research. Do you mind, me working with you? Is there anything that I can do?
Okay, well that's fantastic. Now let me ask you this: You currently are researching the effects of race, sexual orientation, and negative outcomes among LGBT adolescents, lesbian, gay, bisexual, transgender youth.
Yes.
Real world, please explain some of the issues and risk reduction strategies that you've discovered as a clinical research epidemiologist.
Right. This has been a hot topic, or I guess a silent topic because of the nature, regardless of your religious beliefs or so forth. There's an epidemic of negative outcomes experienced by LGBT individuals, starting off as youths per se. There's a, I guess, database or called the Youth Risk Behavior Surveillance Survey, which more or less measures your experiences, health experiences. And in 2015, this was the first year whereby they included information to test whether or not someone's sexual orientation is more than is beyond heterosexual. And as a result of that, they're figuring out, or they found out that there were really negative outcomes disproportionately affecting, I should say, LGBT youths in particular.
Such as?
They have higher rates of depression, insomnia, certain diseases are STIs, not STDs, STIs, but overwhelmingly suicide. So again, as an epidemiologist, we're about prevention. But
so what type of risk strategies, if you can talk about it, have you all come up with?
Well, first of all, we're just identifying, we're getting information out, but we know that there's a difference in terms of outcomes between heterosexuals and homosexuals, again, or LGBT individuals. But in particular, there's even more of a disparity amongst those who are, at least LGBT individuals who are of color. Their rates are off the chart or so. So what do we need to do? We need to more or less inform the public that, hey, this is an issue, whether believe whatever your reasons are for whether or not someone's LGBT, or whether they choose who are born with whatever, that's irrelevant. The stats are there. It's an epidemic of negative outcomes for this particular group. So acceptance, treatment, which not necessarily education, right.
And the reason why I asked that question, I'm going to work my way back around, is that do you employ graduate students to assist in your research, and how do you typically recruit them? Because you said some people will hear about what you're doing. They say, I want to do that. How do I go about doing that?
Well, while teaching, of course, students say, hey, Dr. Campbell, can I do such and such research? So I've had several students who come to me after class, say, hey, you're doing such and such research. Are you looking for, an assistant or an internship opportunity? I said, sure. In some cases, or because of the many opportunities in which we're involved with. So there are opportunities for those students, at least master's in public health students. Believe it or not, we've had graduate students at nearby HBCUs contact me in terms of actually asking me to participate on their dissertation committee. So based upon my health disparities research, or so lupus in particular. Of course, they're not necessarily doing lupus, but they know that my concern is health disparities, and they're really interested in having a faculty member from a very different college, participate. So that's great.
So if you're a student, undergraduate, or you're a postgraduate student, and you're reading a journal article about a particular thing that you may have a passion about or you're interested in, look at the bottom and see who wrote it. That's and right. Possibly contact them and see if you could be a research assistant or assist in the research.
Absolutely. Well, you can start that, or start locally. Again, contact individuals at the local university, local college, and look at the department. And there's a list of professors and the work in which they're doing. Surprise. And there'll be opportunity for you there to actually contact the person who's interested in your field.
Okay. Now, I was looking at Career One Stop, which is a career website where you can research, Google about a career or profession. And it said typical master's degree to work in epidemiology careers are like cellular biology and histology, environmental health, epidemiology and biostatistics, epidemiology, infectious disease and global health, or medical science. And yours was actually a master's of science and preventive medicine. Are there any other types of master's programs that you might think of that may help someone to go into the field of epidemiology, although it's relatively new, but anything else that might stand out in your mind?
I would say when you think of just epidemiology, again, that's just one niche in terms of analyzing data, to improve health outcomes. And that health outcomes in general. But if you're primarily looking at in terms of someone who wants to be a PhD or or in science or so, again, it would be great to have a preventive type, public health type background or science related background itself. But again, you've got the basics for what the MPH, but it depends upon your concentration, let's say, for a PhD in epidemiology itself. Okay. And let's say you're interested in genetics or so, then they would expect you to have some genetics courses behind you or so. Again, just to be, let's say, more of an expert in epidemiology, you should at least have an MS, a Master's in Science, or a Master's in Public Health, MPH, in something related to itself.
So the PhD is whatever you're going to study in that, you should have some background in the master's to lead into that PhD so that you'll have a focus, a specialization, and you'll have some knowledge. Because it's different undergraduate. You can be anything almost, but the master's should lead into the PhD.
Oh, absolutely. Not only that, there are a lot of courses which would be required typically of the PhD that you won't necessarily have to repeat, because for a PhD, you're not necessarily required to have a master's. You can start from undergraduate to school, graduate, to go directly to a PhD program.
Never heard of that. Okay.
Yeah. So as a result, then then there's no master's. Let's say there's some programs whereby, let's say you stop for whatever reason halfway, then you would qualify for a master's. But in some PhD programs, you don't necessarily need to have a master's program to obtain them.
Okay. Well, if I had the time, I'd be like, can we start listing those out? Because some people be like, can I just skip over the master's going to the PhD? We're not going to do that because we don't have time. But I hope that you enjoyed part 1 of this interview about the career opportunities for an epidemiologist. Stay tuned for part 2. Thank you for watching.